skills check off GU system. So obviously I cannot perform such tasks with the person on video because obviously it involves some of the genital parts. So overall I'm going to be explaining this. And I can't use Baby Yoda as a patient. So first off, first and foremost, you're always going to want to introduce yourself as a nurse. So my name is Neo Lingad today. I'll be your nurse, and today we'll be going over your genitourinary system, your GU system, or in other terms, your genital area. Obviously, you're going to provide patient privacy, close the door, close the curtains, anything you need to do. Afterwards, you're going to perform hand hygiene. Obviously, wash your hands, but in this case, I'll be using hand sanitizer. Usually, you always want to wash your hands, always. It's very, very much important. Once you perform hand hygiene, you're going to want to clean, and you're going to want to assemble and clean the equipment that you're going to be using, making sure that they are disinfected, sterile. You don't want to prevent any infection coming from the instruments you are using. And then what you're going to do, depending on the patient, considering if they are male or female, you're going to simply explain the procedure to them, what you're going to do, why it's necessary, what exactly they're going to expect, how to position themselves, and how they can cooperate with you to make this go as smooth as possible. All right. And then you're going to ask the patient, obviously, a few questions. Do they have any kind of urinary incontinences, such as stress, mixed, urge? Stress being when you sneeze or cough, or simply lifting heavy weights. Do you tend to leak, such as pee yourself almost? Does that happen? Or do you have trouble just overall holding it? And then once you can't hold it anymore, it just goes. Any complications with surgery? Have you had any bladder surgery for it? Far and foremost. And then after you get all that out of the way, say patient had, has stress incontinence. So, sneezing, coughing kind of triggers, urine leakage. You can get that assessed right away. Now, you're going to ask the patient, how often do they go to the bathroom a day? So is it once a day? Are they going twice, 3 times, maybe even 10? And then you also kind of have to take into consideration their fluid intake, especially water or any natural diuretics they're drinking, such as caffeinated beverages like energy drinks or coffee. Because for example, coffee being a diuretic, you're going to be frequently using the bathroom more. You're going to be frequently urinating, and that's about it. What else? After you kind of assess the urine output, not urine output. After you kind of assess how often they're going to the bathroom in a day, say they're going about 4 or 5 times a day, pretty normal. You're going to assess the urine output. If they're peeing, okay. And then with urine output being how much are they releasing? Is it a normal amount? Is it a short amount? Obviously, if the patient is urinating a short amount, clearly there are some problems there you need to assess. Afterwards, you're going to assess the color of the urine, the odor, and the consistency of the urine. Is the consistency being like their stream? Are they going at a sort of speed where it's normal? Like it doesn't seem slow. They don't have a hard time getting it out. With the color, usually in a normal hydrated patient, you're going to be looking at a clear, slightly yellow color to it. And patients that are very dehydrated, they're not getting the right fluids, such as they're not getting enough water, you're going to be looking at a very dark yellow, sometimes even brown color. And with that, you kind of need to pay attention to really their fluid intake. You really got to educate the patient on encouraging them to drink more fluids in H2O. That's really important to I lost my train of thought. That is really important to educate upon the patient is their fluid intake, especially with H2O water, because that is important in maintaining the color of normal urine, which is a very light yellow to almost a clear color. Dark yellow and brown is no good at all. And one last thing too is to kind of assess the odor. Like what does it smell like? Obviously, the first time around when you're doing this, you're kind of gonna gag a little bit, but really pay attention to the odor. Does it have a foul smell to it more than usual? Sometimes in regular urine, you'll kind of understand how urine smells like if you've ever had your own or done a drug test for any kind of job that may ask. You might understand how your own urine smells. If that smell of urine smells more foul, more obnoxious than normal, there could be a chance of infection in the bladder. So it's important to pay attention to. And depending on the patient, you are going to want to either conduct a breast exam or a testicular exam. Obviously, I can't really say for the breast exam, but a testicular exam, you kind of want to look at their testes, the penis and the shaft. Overall, is it clean? Is it healthy? Obviously, if you're looking at that, then you can clearly tell if there's going to be any kind of infection in the male genitalia. Afterwards, you're going to want to discuss the findings overall with the patient. Obviously, do not tell it to them in medical terms, something that, obviously us nurses would understand, but clearly something to what a normal civilian, or I should say not civilian, what a normal person would understand in terms of numbing it down to kind of a basic education level. Other than that, that's simply it.